everybody, it's Dr. Joe and Mr. Bear and his buddy, the Get Well Dinosaur. And today we're going to show you my top 7 treatments for a stiff back. So let's get started. He's on your back. Disclaimer alert, disclaimer alert. So one of my favorite exercises / stretches is a pelvic tilt for any kind of back issues. But all of these are really just for a stiff back, not a specific diagnosis. So pelvic tilts are kind of harder to do than you would think if you're doing them correctly. So it's really just like it sounds. You're tilting your pelvis or your hips. So what you want to do is you want to use your core muscles to flatten out your back. So I'm not pushing with my feet. My bottom's not coming up off of the floor or the bed. You can do these in the bed or on your couch if you can't get down on the floor. But you're rotating it back with your hip muscles. So if you feel like you're pushing with your legs, you're not quite doing it right. So all you want to do is, even if you put something underneath there, even like your hands, you want to flatten out your back so you're kind of squishing whatever's underneath there. So with the pelvic tilt, once you get that tilt, you should see that movement right there. You're just going to hold it for about 5 seconds. Just kind of get everything loosened up, get that stiffness out of that low back, and the pelvic tilts are great for that. And then relax. And so holding it for 5 seconds, you can just do about 10, maybe 2 sets of 10 a couple times a day. These are just, again, a really great way just to kind of get everything loosened up in that low back area, get that stiffness out of there. So once you do the pelvic tilts, then you're going to go into a full bridge. So this time your bottom is coming up off the floor. You're using your glutes, you're using your hamstrings, and you're really kind of driving your knees forward when you come up. And when you come up, you want to kind of come up one segment of a time at a time of your back. So you don't have to like stop at each segment, but that's the motion you want to do. You don't just want to come straight up. You want to kind of roll your back up. That's what's going to help get some of that stiffness out of there. So you don't necessarily have to pause. You want to get fairly straight once you come up, but then nice and slowly come back down. So again, probably about 10 of these, a couple sets of 10. You don't have to go crazy with it. Sometimes doing them in the morning and then again in the evening before you go to bed is a really nice way to get everything loosened up, get that stiffness out of there. So after that, you're going to go into a little bit of a trunk rotation while you're lying down. Slide your feet a little bit closer together so your knees are touching. And then you're just going to bring both knees over to one side. Your hips are going to come up a little bit off the floor, but your upper body should stay down. And you should just kind of get a nice stretch on the outside of your back and your hips. So this is getting some of that rotation now. Just a little pause, maybe 5 seconds or so, and then roll back up and then go the other way. So again, you can see I'm coming up a little bit here, but my upper body is staying down on the floor or on the bed or the couch, wherever you are. So since these are kind of a 5-second hold, maybe 10 seconds if you want to get a little more of a stretch, I'd just do maybe 5 on each side. Again, you can do a couple sets a couple times a day, but this is a really, really good one just to kind of get the side of the lower back stretched out now that you have, doing the front to back. So it gets kind of everywhere in that low back. Then you're going to go into a single knee to chest stretch. And again, it's just like it sounds. Propping both knees up. Some people like to put one down. They feel like they're getting a better stretch. But if you have some back tightness, some back stiffness in there, I think leaving one propped up is a good way to do it. If you have knee issues as well, sometimes people grab like this, but if you have some knee issues, sometimes people get a little more pain because they're pushing on that joint. So you can grab underneath here. I like to do it this way, but if you want a really good pull, some people just kind of wrap around up on top, which you can do as long as that's not painful. So with the single knee to chest stretch, this one, you want to hold it for 30 seconds. So this is a full 30-second stretch. You should kind of feel it in the bottom area. You should feel it in that low back area. And then I like to alternate back and forth just to give the other one a break. And so once you're done with that one, then you give this one a good stretch. And so again, 30 seconds, doing 3 on each side. So this one's, a little bit longer hold, but just you can, do nice relaxing and just get everything stretched out. After you do the single knee to chest stretch, then you're going to do both of them together, which we just call double knee to chest, or some people call it the egg roll. But this time, you're just going to come up with both knees. So again, if you don't have any knee issues, some people just kind of like to grab it like a hug if you can get your knees that high up. If you can't, then you can just kind of grab underneath here and pull up. But again, this is a full 30-second stretch, holding it and then doing that 3 times. If you get a little bit of groin pain with that, just don't push up into the pain. Just stop where you're feeling that little bit of a tension. And so then you're going to roll over onto your knees. And as long as you don't have any knee problems, so there's not a whole lot of pain, kind of sit back, and then you're going to go into the prayer stretch, or a child's pose. And this one's really nice because it's not only great for a stiff back, but it's kind of good for your hips, as you can see, your knees, and your shoulders. So it's a really kind of a great whole body stretch, but it's really good for your back when you have that stiffness. So you can do a couple ways. Some people like to sit back and then just stretch forward into the stretch. And again, you can hold this for 30 seconds. Or some people like to put their arms out first and then sit back into it. So you can try both ways if you want to and just see whichever one's most comfortable for you. And again, you might not be able to sit back this far, and that's okay. To modify it, you can stand and then maybe go to a counter and then just roll down onto the countertop, and that's kind of similar. But if you can get into this position, this is going to be the best stretch. So again, 30 seconds, 3 times. And then the last one is just cat dog or cat cow, a couple different terms for it, kind of stretch. So you're going to get on all fours. Again, you want to make sure you're kind of in a really good position where your shoulders are right above your hands, so you're not irritating something else while you're doing the stretch. So when you go into the cat portion of the stretch, you're going to arch your back up and then tuck your chin in while you're doing it. So you're kind of arching up like this, like when you see cats do it. Bear likes to do it a lot too. But tucking in that chin, you don't have to hold it for a full 30 seconds. You can do maybe like 10 to 15 seconds. And then when you go into the dog or the cow, whichever one you want to call it, you drop kind of your hips down, and then you want to look up. So that gives you a nice stretch through here as well. And so again, just holding that 5 to 10 seconds, but it's a really, really great way to get some of that stiffness out of that back. And so you can just alternate back and forth, maybe 5 times each way, again, a couple times a day, just to get everything really stretched out. So there you have it. Those were your top 7 treatments for a stiff back. Bear says that Mr. Dinosaur has made his back feel better. So if you'd like to help support my channel, make sure and click on the link up there. And don't forget to subscribe by clicking down there. And remember, be safe, have fun, and I hope you feel better soon.